Thank you guys for joining. My name is Kevin McAvey. I'm a managing director at Manat Health, and it's a real privilege today to be able to join the Robert Wood Johnson Foundation and Academy Health Health Data for Action interview series. Today we have three really special guests who I'll ask to introduce themselves, who really demonstrate how we can leverage existing data in our landscape to answer some of our most pressing and timely questions. And so, Chris, I'd love to hear a little bit about your background and who you are. And
Sure. Thanks, Kevin, for having me here. Really appreciative of the whole program for the data access. I'm a MD PhD student at Duke. So my PhD is in public policy and economics, and I study a lot about healthcare pricing. So I think that a big question in that broadly is how are prices determined and what is the effect of various policy interventions. So price transparency is a big example of that. So just been working on trying to understand both what we can learn from it and what it has done.
thank you for joining. Kristin.
Hello, everyone. My name is Kristin Paulson. I'm the CEO for the Center for Improving Value in Healthcare. We administer the all-payer claims database for the state of Colorado and provided APCD data to Christopher for this project.
Terrific. And Rafiq.
Hi, everyone. I'm Rafiq Ahmed. I'm co-founder and CEO of Serif Health. So we work with all of the newly made available public price transparency data published by payers and hospitals, and have built a variety of price intelligence and data products around extracting, enhancing, and standardizing this massive volume of data. So really excited to be working with the Robert Wood Johnson Foundation and Health Data for Action and folks like Chris and Kristin in terms of getting this data out to more and more people to really understand kind of the landscape of healthcare pricing.
I'd really love to dig in. Like, this is the first time I'm really kind of have the opportunity to talk with you and hear about Serif Health, and understand like the price transparency data that you have available to you. And I'd love to kind of also at some point in the conversation talk about how it might compare or contrast with the data that might be available, Kristin, from an APCD. But maybe to take a step back. So, Chris, you started talking about your journey and your interest in investigation and prices in our healthcare system. It's a hot topic on the Hill. I think it is one area, one of a few areas, very few areas of bipartisanship on the Hill, knowing that like our healthcare prices and costs continue to grow every year. Could you tell me a little bit about like some of the questions that you generally receive about healthcare prices, and then how you wound up investigating private equity's impact on prices?
So I think that a lot of people kind of start from this idea that like they have no idea what the prices are. And so the questions are very often like, well, how are the prices even set? How am I supposed to know where to go for healthcare if I can't even see the prices? And that kind of lack of information is the idea behind some of the price transparency policies that we've seen in the last 5 or so years. And by passing those price transparency policies, Congress and CMS have required both hospitals and insurance companies to post these prices that Rafiq and his team have kind of collected in terms of the transparency and coverage data. And the idea there is people will now have some more information, and they maybe will be able to go somewhere where they can get better value. The thing that I'm kind of interested in, though, is that information can do a lot of things. So the idea behind the price transparency policies was for consumers to use it to price shop.
How'd that go?
We have some prior evidence from prior like state level price transparency policies, particularly in New Hampshire, that prices have decreased. So kind of the information idea has worked. We're a little bit concerned when it comes to something like hospital care because there aren't so many hospitals. And very often you're going to the hospital because you don't know what you need. And potentially you're going to the hospital through the emergency room. So a big concern that we have is kind of broadly that people other than consumers are going to use this information. And maybe that's good. Maybe that means health insurance companies are using this information, or large employers are using this information and saying, why are we paying so much for healthcare? Like, we can see all these prices. We need to get better deals in our negotiations with hospitals. But the flip side of that is that the hospitals can also use the information. So now we're kind of in this theoretically ambiguous world where maybe this information lets hospitals actually bargain for higher prices because they can see what every insurance company is paying their competitor.
Kristin, talk to me about the evolution of price transparency and how APCDs have been useful.
Sure. Thanks, Kevin. So the Colorado APCD has been around since about 2012 and has been used to advance price transparency and get an idea as far as what are people paying in the market for the last decade and a half. When the new price transparency laws came into effect several years ago, I'm sure Rafiq is very familiar with this, there were no standards for how to be posting those or where they should be posted or how folks were supposed to find them. And so though there was, especially at the beginning, an increased emphasis on price transparency, what ended up happening is that we got increased focus on us to say, well, we can't even find these other records. What do you guys have that would be equivalent?
Mm-hmm.
And then when they started to become more standardized, well, how do those two compare?
Yeah.
And so one of the big projects we work on with the state of Colorado is actually a comparison to validate some of the prices that are posted by these hospitals on their websites against the actual claims data that we get from those same insurers for those same hospitals and same services. And so it's a large project that we do every single year. And I will say that there is significant variation between the two. And so the actual claims and the prices listed in these price transparency postings are very different. And
Why?
so that's an excellent question. And Rafiq maybe has better insight into that. But, we saw things like $600 phlebotomy charges. There's a lot of variation out there. I'm not sure all of the impetus behind it. But we certainly have found that we've had additional insight, additional focus from across the board in what price transparency means. What do we consider valid price transparency? What is the source of truth? And what are the sources of variation?
So Rafiq, talk to us about a source of truth. During the first Trump administration, price transparency files were born, and so was Serif Health.
So a lot of the genesis of the recent price transparency kind of data sources that are now available was born out of a 2019 executive order, and then actually the laws were implemented during the Biden administration in 2021 and 2022. So that kind of speaks to the fact of what you mentioned at the top around the bipartisan nature of getting this data out there. But in terms of source of truth and kind of where Serif Health came in is that we didn't start as a price transparency company. I was actually working on a cardiology platform and then wanted to use the price transparency data to help me understand pricing better around cardiology services. No real standards around how they were posted. We saw file formats from, XML formats to JSON formats to CSVs, PDFs, like super old file formats across the board. So we were building custom data pipelines for like each hospital in each format the data was coming in, and realized, oh, wow, this data is not easy to use. And if anyone thought it was going to be simple, like that wasn't ultimately the case. So that kind of led to us going down a path where when we started speaking to more and more, whether it was consultants, providers, companies building customer facing or patient facing platforms, we realized that everyone had deep interest in this, but was struggling to use this data. So that's kind of one piece there. And then to get to the idea of source of truth, there's been some enforcement around the hospital provided data and more standardization of the schema. So we've seen drastic increases over the last few years in the accuracy of what hospitals are posting. But because the payers have been posting huge amounts of data on the order of like petabytes of data in terms of every price attached to any in-network provider,
everything in the kitchen
for
sink,
any given procedure code, everything in the kitchen sink. that's not super enforceable if you're the government. So you do not necessarily have the engineering capacity, time, and effort to go in and be like, hey, on the surface, everything looks like you complied. You have files that are available for people to see, but what's inside the files is the real question. And so that's where kind of the existence of Serif Health came in, because there needed to be companies in the space that were able to clean, kind of understand, apply data science, and try to improve the overall accuracy of the data that exists. So we do validation in a lot of ways. We do macro analysis of kind of looking at claims data and other sources like APCDs or whatnot to see, do these prices make sense? What doesn't? What does make sense? What doesn't? And then we also work with a lot of provider groups to see what their contracted rates are and then cross-validate that with what health plans are posting. So,
but Rafiq and Kristin, like, who are the primary folks that are really interested in this price transparency or cost data that are coming to you and seeking to use this information? You mentioned providers, Rafiq.
Data forward organizations are kind of the first adopters and customers that we see. So in that case, it is provider groups, especially hospitals and health systems, who want to use this, as Chris mentioned, for contracting and understanding market pricing. Health plans themselves want to understand, how does our network stack up relative to other health plans? And purchasers as well, whether it's the employer or maybe the third-party administrator administering those benefits, wants to be able to pull in this data to help provide cost estimates or analyze the cost of care. And then we see a lot of, I would say, consultants and technology firms that work kind of in the healthcare ecosystem, whether they want to incorporate this into their healthcare models, understand provider network costs. Those are, I would say, like the early customers, especially because all of this data is not, it's not 100% useful. There are holes in it and areas where certain regions, certain payers are better than others. The first users of all of this data are going to be those organizations that want to get certain market insights.
Really interesting. Kristin, does that like resonate with you? Like well-resourced health systems, payers, purchasers?
We also work a lot with researchers. So we do a ton of work with research entities and folks like Chris across the country to be looking at what price transparency means, what does it mean to the consumer. We do have the benefit of actually having those co-pays and the co-insurance amounts. We are able to track what deductible payments are being made. And so that's an additional nuance that we get from the claims data compared to the publicly posted data that makes it appropriate for different kinds of purposes. The state also uses a lot of the data for policymaking, for decision making. It's used as the basis for our Colorado option plans. We also use a lot of the data to support consumers. Because the APCD is a state mandate, part of our charge as the administrator is to make sure the data is accessible to the people that are represented in the data.
Let's talk about private equity. How are private equity firms using this data in ways that we might not have initially anticipated? And is it good or is it bad, or is it just
so I think that's a great question. I think that one of the potential hypotheses that researchers have and that I'm trying to investigate is this idea that private equity firms, so they buy other companies, try to improve how they run, and then try to sell them. There's an additional concern, though, that when they start doing this, or as a part of their strategy in doing this, they won't just buy one or two practices. It's called a roll-up strategy, where they'll buy a whole number of practices, and then not only can they increase prices at the low price providers, but they can become almost a monopoly. The concern is just that this information, I think kind of actually both of information and private equity as like microscopes or magnifying glasses, where they exacerbate or show us where markets aren't working very well, right? So like information is going to let people who are taking advantage of any market imperfections do that to an extreme. Both the information and the private equity activity kind of show us where our healthcare market's not working in ways that we as a society might want them to. We should be paying attention to maybe not the first thing that we think of when we introduce new policies. When we think about price transparency, we think about consumer shopping, okay? That would be a potential effect. But what are all of the other potential effects, and how is all of that going to balance out?
But like I'm hearing from you, like there are private equity firms, and I would say like any kind of large purchaser in a market might be able to use this data to kind of pinpoint where there's some sort of price disparity, and then figure out how to make profit by closing that disparity. The other thing I'm hearing is private equity firms and other organizations might kind of use data like this to actually, given their significant financial leverage, change markets in significant ways to be able to kind of lift up prices. And so this is, again, like to your point, not necessarily the intended effect of having all this the price transparency data out there, but could be a second order effect. So talk to me about how are you going to actually investigate this question and this issue? What is that?
I mean, I'm very lucky to have data from both Rafiq and Kristin's organizations. I think that they're different kinds of data, and so I'll use them in different but complementary ways. So I'll start with like the transparency and coverage data. So Rafiq's data, this is a really helpful data asset just because it is so comprehensive. It's very hard to get data in healthcare, and very often we're dealing with kind of subsets of markets. Either we're dealing with like just Medicare, because that's a centralized government insurance plan, so we can get all of Medicare beneficiaries, but that's only people over 65. Or we can sometimes get data from a state Medicaid organization, but that's then just one state and just Medicaid. So getting kind of nationwide comprehensive data for the commercially insured is very hard. What I can do with the data that Rafiq has kind of assembled is look at private equity acquisitions. So this is kind of an additional set of data that I'm collecting, and look at within a geographic area and specialty market, what are the prices of the practices that are getting bought by PE firms. Rafiq and his team are working on making kind of their transparency data not just a snapshot, but like year over year, so a panel, as we would say in the research world. And then, yeah, that would allow me to potentially look at least how these posted prices are changing after an acquisition. Needed Kristin's APCD, because that has data from before the transparency and coverage laws were passed. So the strength there is one, it's before the policy. So I can do like a before and after. And then, as Kristin also mentioned, there's a strength in that it has like the patient cost sharing amounts. So you can dig into like, okay, well, prices are increasing by this much, but like how much is that affecting consumers? And then the quantities are really, really critical, because if we just have a price list, like all the petabytes of data that are on these insurance company websites, in an extreme case, like those services might never happen. Like there might be prices up there for some CPT code that provider never actually provides. So having a data source where we have both pre-period data and quantities along with patient cost sharing really lets me get much deeper into the like, how much does this matter and who does this matter for?
Rafiq, would you mind kind of talking about like how you really thought about Chris's request and were able to kind of support his project? And then Kristin, I'd love to hear your perspective on that as well.
Yeah, no, we were very excited to be a part of Chris's project, because I think like as a company working on price transparency, thinking about our mission and why we started working on it, understanding where our price is going from here is super critical. And there's so many countervailing forces happening in terms of getting this data out there, that being able to support research around, okay, is this policy direction of bringing price transparency regulations out there and publishing this data working in the way that it's anticipated? And if it isn't, what needs to be done to make it move in a more productive direction? And so I think from our perspective, we want to make this data more available across the healthcare ecosystem. And our view is that one, that reducing information asymmetry is a good thing. So across the board, I think we hope that over time the prices go down and get to a more sustainable level, especially around working with folks like purchasers of healthcare, like employers, where they are, seeing those year-over-year price increases in healthcare
Mhm.
costs and are extremely motivated to find a way to make them more sustainable. But at the same time, as Chris mentioned, there are, investors in healthcare practices, whether it's private equity, whether it's the insurers themselves, whether it's hospital systems. There's a lot of consolidation going on in the
Mhm.
marketplace, and any rational economic analysis of healthcare in America shows that almost every state is
Mhm.
anti-competitive to some extent in terms of how healthcare
Mhm.
works. So being able to understand kind of how the data is being used by certain stakeholders is really important, and I think we want to understand as much as possible. So I think our goal as a company in terms of making this data more usable is definitely part of that. Is can we get this in the hands of researchers like Chris
Yeah.
and others who are really going to help us understand, like, what are some of the more short-term impacts of price transparency data and its impact on costs in healthcare, as well as what are some of those long-term effects that we might be anticipating or not anticipating kind of moving forward.
And I just wanted to build off of something that Rafiq just said, which is, our goal is to get the data in the hands of the people who can use it
Mhm.
in whatever format that needs to be. And that's really, I think, that's the charge we have. It's the charge that a lot of APCDs and a lot of these large data folks have got is how do we put the data to work for the people who are dealing with the healthcare system. One of the opportunities that we had was to get involved with the RWJ Health Data for Action program as one of the data sources through that, which is a program that enables folks like Christopher, who are working towards PhDs or her early career researchers, to get access to data sources they may not otherwise be able to access,
Mhm.
and to be able to have access to some of our analysts to be able to support some of the work and integration into their projects. When Christopher's project first came in, we were really excited about it because this idea of identifying acquisition points and identifying who's acquiring practices is something that we've been very interested in.
Mhm.
Um, we get a lot of data, but we do not get health system affiliation for clinics, and so trying to get to that data, trying to get that information is an enormously laborious and complicated process that we have not been able to efficiently figure out in a way that would make sense for us. So the idea that Chris is going to be looking into this and being able to attach sort of acquisition and acquiring entity to some of these clinics was really exciting. And I think at the beginning, actually, we were a little skeptical just because we know how challenging it is to actually put those pieces together. And we had a meeting with Christopher just to say, can you really do this? Do you actually have a plan to do this? Is this going to actually work? And we were really excited to hear the approach, the methodology that Christopher was using. And I'm excited to see the data that has come out of that. And the results of the project, which is, some of what we've been trying to get to for a long time.
Is price transparency the solution for cost growth? And I'd love everyone's quick thoughts on that question. But Chris, talk about like where you go from here, what you're hoping to find, and what lessons other researchers
Sure.
should take from your
So, I mean, I
experience.
think that where I go from here is do a lot more like checking and due diligence on all of the linking that Kristen was describing is quite difficult. I think that that's one of the tricky parts of this project is that identifying acquisitions is hard. So definitely put a lot of work into making sure that that data set that I'm constructing is really high fidelity so that I can then answer kind of the core research question, which as I described before, it's somewhat straightforward. Like, where do PE firms acquire low
Mhm.
price practices? Do they increase prices? Did they do that more after tick? I think a lot of the work is on the construction side of the data that feeds into those analytics, which is kind of a segue into the second part of your question of do I have any thoughts for other researchers who are trying to use this data? And I think that yeah, one, it's hard. Like the just from a computational perspective, the data is very large. It can be difficult to work with, and I think that it's definitely worth
Mhm.
taking your time um, because we don't like we need good research and rigorous answers. And because of the complexity of the data sets, it's not that difficult to get a pretty confusing answer. Okay, there's thousands of procedure codes and there's a bunch of different types of providers. Some of these insurance companies are posting prices where it's the price to get a neurosurgery done at a pediatrician's office. We don't really think from like a just logic perspective that makes a lot of sense. But if you just downloaded the tick data and took a straight average of the prices for this neurosurgery, you're going to get the wrong answer. So I think my advice then would be to work with people like Rafiq and work with people at Kristin's organization. I spend a lot of time talking with their programmers to understand how are they actually getting the data. Do they think that there are any issues with how it's being submitted by either payers or whoever the data source is? And just really to take your time and call on data scientist experts to, in like industry experts who know the industries that this data describes, to make sure that what you're getting out of it from a research perspective makes sense. So I think those are my two big takeaways. Is one, like, it's going to be a bit of a slog, so consult the experts. But also don't just think that just the idea of getting as much data as you can and then figuring out the question, I think is not that efficient of a strategy in this world where like you're going to be kind of drowning in data.
Yeah. Be really confident in the questions that you're trying to answer. Think strategically about the data resource or resources that you might need to answer that question. And then I'm also hearing know your data. Like really talk to experts, really understand where it comes from, what it shows and what it doesn't show, and how you can further kind of either caveat or improve its quality by pairing and providing that context. So I promised a final round around the room. Kristin, is price transparency data the solution for cost growth?
Short answer, no. I think price transparency is necessary but insufficient to be able to drive cost growth, in part because there are holes and there is a significant missingness with the data that is available in terms of price transparency. We've got a lot of really robust data sources. Rafiq has got an enormously robust data source. We do as well, but there are serious limitations. We're working, Christopher, to your point, to be able to pull together multi-state APCD data to be able to provide some of that. But it's not, it's a tough lift, and there's still going to be missing populations. We still don't have the federal employee health benefit programs or VA. We still don't have part of the commercial market through our large or our ERISA employers. And so, our data set has got significant missingness that makes it a necessary part of the equation to drive down prices, but not sufficient to get us there fully.
Necessary, but not sufficient. Rafiq, do you agree?
Yeah, I will give my slightly more optimistic spin as the price transparency data company here, but I will say critical first step, but agree with Kristin that it's insufficient on its own. But as a first step, I think one thing that I always think about is, what was the status quo before price transparency data came out? And so significant step in the right direction in terms of unmasking, especially commercial healthcare reimbursements that really never existed before. There's definitely holes, challenges, things that need to be improved here. But I think in a lot of ways, being able to get these unit costs on reimbursement rates in healthcare really helps set up the stage for what do we really need to kind of think about for our next steps from here to really understand, what healthcare costs are to try to ultimately get costs under control. But this is where I think I want to definitely emphasize what Kristin and Chris have both said. Being able to think about unit costs is one thing, but then once you're able to get a stronger handle on that, thinking about things like the total cost of care, quality, the episodic and longitudinal cost of care really also is something that really needs to be understood in a better way. And so I think price transparency helps get us part of the way there and really can do certain things to move the needle. I think, if you're a purchaser of healthcare, you can choose a more cost-effective plan upfront or think about steering patients more effectively to care, but you still need to understand, if if the care that's done isn't a good job, then they're going to be way more costs down the line? Or how do I actually think about all of these different aspects of total cost kind of over time? And so I think more partnership like this is really critical, and then understanding where the holes are and figuring out ways to improve those over time is really going to be the key.
So, Chris, grounding us as economists always do in the last 30 seconds or so, is price transparency the solution?
So I'll agree with Kristin and Rafiq and say it's not the solution, but it could be part of a package of solutions. I think that, calling back to kind of what I said before, I think about it a lot as like a magnifying glass, or maybe it's just, in this case, turning the light on in the room, that we can now see what we're dealing with. I think that as a policy intervention, adding information to a market, any economist will tell you, like, what effects that has depends on the nature of the market. So it's not going to work on its own when we have somewhat uncompetitive healthcare markets, but potentially it is part of a larger package of policy interventions that are, as a whole, can increase competitiveness in the market. And that is, at least the way we have things set up in the US now, increasing competitiveness is kind of the avenue that we have available to try to put downward pressure on prices.
Well, Chris, well said. I want to thank you, Kristin and Rafiq, for all taking the time to talk about your research journey together. I want to thank Robert Wood Johnson Foundation and the AcademyHealth for setting up the Health Data for Action Research Program to really present a model for how we can leverage data that's out there right now to help answer some of our most pressing policy and program questions, help us better understand our healthcare system and how it's working, and sometimes how it's not. So thank you all for taking the time today. Really appreciate it.